Dr. Tom Frieden. He's president and CEO of the Global Health Initiative Resolve to Save Lives and also the former head of the CDC. Good to be with you, Tom.
Great to speak with you, Ian.
So, nowadays when we talk about this pandemic, there is so much politics around the parameters of what we're hearing, around how many cases are there really. Why don't you tell me right now, to the best of your ability, what you think the reality of the pandemic is compared to the figures that we're seeing in the papers every day?
Well, you're absolutely right. There has been partisanship infecting our response to this pandemic. And what we see in every country and every community around the world is that the virus exploits the fault lines of society. And one of the fault lines of our society is partisanship. So even things that really shouldn't be partisan become controversial, masks being one example. But if we look at the US, first off, you have to say it's not just one epidemic. There are many outbreaks. All epidemiology is local, just like politics. And what you see in many of the states of the Northeast is a relatively cooled down pandemic. Still, a lot of cases, if you compare it with countries in Asia and Europe that have really crushed their curves. But what you see in much of the south of the US is explosive spread. And one of the things that frustrates me as an epidemiologist is that the media are paying attention to the wrong numbers. They're obsessed with, are there 11,000 cases in Florida today? Well, we know that we're underdiagnosing by 3 to 10-fold. So people are saying, oh, are there going to be 100,000 cases a day in the US because there were 75,000 or 80,000 diagnosed? Well, there are already far more than 100,000 every day. We're just not diagnosing them all. And similarly, there's been this obsession with the number of tests. Oh, we're up to 700,000 tests. Wait a minute. But they're taking a week to come back, 10 days to come back. They're very close to useless in that circumstance. If we really want to get a handle on the pandemic in the US, we have to have a much better view of what risk is and what our response is. And those are the two things that we should focus on. And right now, the risk is very high in much of the country, and our response is quite problematic in much of the country as well.
So you've said that a big piece of the problem with data is actually at the federal level, not at the state. And I'm wondering where you think the federal government has fallen down. What exactly is this resolvable in the near term?
One of the things that we can do soon is get a much better standardized sense of how we're doing in every state and every county of the US. There should be standard definitions of the most important indicators. We released a list of 15 essential indicators. And what we found was if we went onto state dashboards, no state had even half of that information, and most states had less than a fifth of it. So we're flying blind in this epidemic. And the more the federal government empowers states and counties, defines clear indicators and expectations, and the more we in the public and the media insist on it, we'll have a much better sense of two crucial facts. One, what's our risk? And two, how well is our response going? What can we do to get the virus into better control, what we call boxing the virus in with strategic testing, fast isolation, effective contact tracing, and supportive quarantine. You do those four things, you get the virus in a box that's smaller and smaller so we can come out more. And right now, we don't know how that's going really in any community in the United States.
People are more concerned now in the United States about reopening schools than almost any other factor. I heard Bill Gates the other day saying he thought it would be safe to reopen schools in fall 2021. Now, you've come out with a public plan for the steps that need to be taken. Want to sort of give us a broad outline and what, if anything, you think can be done for this fall?
Well, first and foremost, the single most important thing to get our schools to be able to open is to control the infection in the community. If you have explosive spread, as you have now in Phoenix and parts of Texas, Florida, it's not going to be possible to open. Of course, you can open, but the real hard part is to stay open. And once you have a lot of cases in a school, you're going to have to slam back shut. So the most important thing all of us can do is work together and stay apart. wear a mask, wash your hands, watch your distance, the 3 Ws can allow us to bring the infections down. And governments, where there are lots of cases, have to shut bars and indoor dining because those are major propagation points for the virus. Once it's down to a lower level, it's certainly possible and really important for schools to reopen if at all possible. That means shielding the most vulnerable. Teachers and students with underlying conditions are going to need to continue to teleschool. Rearranging how things work in schools so there aren't as many commonly touched substances. Keeping students apart and in pods or cohorts so that if there is one case, you don't have to shut the whole school. You can quarantine one small class or a grade. And universal masking, really important. But none of those things in and of themselves is going to ensure that there are no cases. So every school needs to have a protocol and be prepared for when there are cases so they can take appropriate action and minimize the loss of education. Schools are important not just for education. They're important for social and economic development. They're important so parents can get to work. They're important so that kids can get health care and nutrition and mental health services. So we all want the schools to open. The key is to open them in a way that they can stay open.
So you ran the CDC. We still have a CDC in the United States. It has management. We've also got the much celebrated Dr. Fauci. We've got Dr. Birx. They're still out there talking to the media all the time. How are the health professionals doing? How are they holding up right now in the United States?
Well, first and foremost, I think we need to do a much better job protecting people on the front lines. Every time I see the numbers of healthcare worker deaths, I see another healthcare worker dying, it's just heartbreaking. Here in New York City, Steve Kamholz was someone who I've worked with for years. He was 72 years old. He wanted to go in and help people. He got the disease. He was teaching from his bedside, trying to help people. He was just a totally committed physician. And to see someone like that die from this is horrifying. And I think it's largely preventable if we use a systematic way of preventing infections. And we get much better about face shields and reusable protective equipment and environmental and engineering controls, source controls, universal masking in hospitals. We should be able to dramatically reduce the number of healthcare worker infections and deaths. And that's crucially important.
We're 6 months in. Tom, are you saying we still aren't getting basic health protocols around coronavirus in place in hospitals? Are we lacking supply chain? What's the principal miss here?
Well, I think one of the most important things that we must do is be much more transparent with information. There have been more than 500 deaths of healthcare workers that we know of in this country, and more than 80,000 infections of healthcare workers that we know of. These are mind-boggling numbers. When I, early in my career, worked on tuberculosis, when we had a single death of a healthcare worker, it was such an outrage that there was national action to protect healthcare workers. So if we knew that, the number of healthcare workers infected in your area, every week in every area, I think there would be pressure to get that number down towards zero. Because it's possible. There are other countries that are not having this kind of infection rate in their healthcare workers, and we have to do much better.
There's a broad logic, you could even say it's a conventional wisdom about the United States, that we have the worst system that is the most expensive among the advanced industrial democracies. To what extent is that true, and how has that played out in terms of our inability to effectively respond to this coronavirus?
Well, when you come to our health care system, there's no doubt we spend twice as much on average per capita, and our outcomes aren't good. In fact, if you look over the last couple of decades, we've gone down in the ranking tables while we've gone way up in the spending tables.
In the cost tables,
something is definitely not working for us here. And some of that has to do with the cost drivers of care, our overpayment for medications, our overuse of procedures. But the one thing that I think could be most important in our health care system is to drastically change and improve the role of primary care. We have a very weak primary care system, and it's being slammed by coronavirus because people aren't coming in for visits. And a lot of our primary care works on a kind of piecework basis. Patient comes in, you get paid. They don't come in, you don't get paid. We need to move to a place where everyone has a right to a primary care physician, where primary care physicians work in teams with nurses, pharmacists, social workers, outreach workers, where there's a panel of patients and a responsibility for that panel. The outlines of what we need to do to improve healthcare in the US aren't actually that complicated. It's pretty straightforward. You'll have some debate around the margins, but it's pretty straightforward. We need to do much better primary care. We need to assign responsibility for patients. We need to follow protocols. We need to incentivize quality and value, not volume. What's hard is the politics of it.
So, macro picture here, globalization, people travel faster and faster, more and more across the globe, and livestock too. That clearly raises the risk of pathogens being transferred. On the other hand, technological improvements happening exponentially, allowing us to identify and respond and collect data much more quickly. Given those two competing trends, do you think the risk of global pandemics overall is going up, going down, or staying the same, and why?
Well, I think the risk is going up because of our increasing interconnectedness. We have a gap in that now because of COVID, but we are increasingly globally interconnected. And that will probably resume at some point in the next couple of years. And we're also encroaching more and more on the animal habitat. And that's where 3/4 of these new infections come from. So I think we face the inevitability of future pandemics. There are lots of animals. The microbial kingdom outnumbers us. A wonderful microbiologist, Josh Lederberg, he won a Nobel Prize. I remember him saying, the microbes outnumber us trillions to one. It's their numbers against our intelligence. And that intelligence means setting up early warning systems around the world, closing the gaps in preparedness. We talked about the US, but globally, through the World Health Organization and others, we now have, for the first time, pre-COVID, a very good sense of where the gaps are. And there are close to 10,000 life-threatening gaps, lack of tracking systems or lab systems or rapid response capacity, all over the world, especially in Africa and parts of Asia. And we're really not doing what we need to do to close those gaps. And that means we're all less safe. We've estimated that it'll cost about $10 billion a year for about a decade to make substantial progress reducing the risk of pandemics around the world. But that's a tiny price to pay compared to what we're paying for failing to prevent this one.
So, as someone who deals with a lot of these really horrifying diseases, which one kind of freaks you out the most? And I mean sort of personally, right? Do you wake up in a cold sweat occasionally thinking, oh my God, I just contracted X?
Well, I think most of us have feared pandemic influenza the most because something like the 1918 pandemic, if it happened today, could cause tens of millions of deaths. What you're worried about is something that spreads like flu and kills like SARS. Now, COVID is
not that.
Not that, but it's not all that far away. It spreads more than flu, but it doesn't kill anything like SARS. So you've got really a bad one, but we could get a worse one. And one of the things that I've said for years is we can't predict what the next one will be. No one would have predicted that H1N1 influenza would have emerged from Mexico. Usually new flu strains emerge from Southeast Asia for whatever reason, nor that we'd have MERS in the Middle East. So it's hard to predict what's going to happen next, but it is predictable that there will be a next time.
And before we go, I got to talk about the vaccine because, we know there's well over 150 in various stages of development right now. Where do you think we stand?
Well, it is encouraging. Some of the data suggests that people get natural immunity. We don't know that yet, but some of the immune responses are quite robust. We don't know how long people will be immune, to what extent they'll be immune, whether that immunity will be in all groups, the older people as well. So I'm guardedly optimistic that we will have more than one vaccine that is protective within sometime the next 6 to 12 months. What concerns me is that we make sure it's safe And vaccine safety is really important because remember, you're injecting something into people who aren't sick, and you're going to do it millions and millions of times. And even if there's a rare adverse event, it's going to be a big problem, not just for that individual, not just for COVID, but for vaccine confidence. That's why we can't cut any corners on vaccine safety. There are some things that do concern me. I'm particularly worried about this Kawasaki-like disease, multi-system inflammatory syndrome in children.
In kids.
Yeah. So
Yeah.
that's an excessive immune response. And what's to say that won't happen or something like that with a vaccine? So I don't want to create fear, but I want to be completely transparent. One of the other things that concerns me about COVID is this loss of sense of smell and taste. Implies that there is damage. It's not to your nose, it's to your brain. And how long is that going to come back? Does that imply that there might be some long-term sequelae? I'm not trying to be sensationalist or scaremongering. I think it's important that we can be completely transparent about the things that we're concerned about and will track so that we can look closely and see if it's a concern or not.
Tom Frieden, thanks for helping us chart out some of this uncertainty. Really appreciate it.
Thank you, Ian.